As a man, have you been having poor energy, low libido, having problems with erections and developing muscle mass, and you check your testosterone levels and your testosterone levels were low? You started therapy with testosterone and it's still not making happen. Well, here we are to give you the key elements to fix your testosterone therapy and feel much better. Follow me in this video. Hi, I'm Dr. Elenaxi and I'm here to talk to you about how to fix your testosterone therapy. And you need to be aware that when you start testosterone therapy, you need to have present the estrogen level. Yes, you guys as males, you also have that female hormone called estrogen. But again, you don't want to have neither too little, neither too much. And when you start testosterone therapy, it's good to know your levels because certain gentlemen, they may have a genetic predisposition to turn the testosterone into too much estrogen because of too much activity of an enzyme called aromatase, that is the one that does the conversion. And also, gentlemen with a lot of fatty tissue, they will have much more activity of that enzyme turning testosterone into estrogen. You will need to have your estrogen levels at the beginning of the therapy, and also it's good to check it 6 weeks later, because if this is happening and your estrogen levels are getting too high, you need to do something about it. Usually changing your lifestyle, eating less processed food, try to take a supplement, name it DIM, at least 300 milligrams a day, that has anti-estrogenic effects, and also trying to check those levels and be sure that they're not going higher than 80 picograms over ml. Well, that would be good to know, because if it's going that high, you may need to have something to reverse it. And there are hormones that you may need to use, like progesterone or pregnenolone, that they may balance this conversion. And if that doesn't work, you may need to add an inhibitor of the aromatase. There are medications that you can have. One of them is the Arimidex, or the generic is the anastrozole, that you may need to start if this conversion keeps happening. Because if your estrogen gets too high, you're gonna feel bloated, swollen, you will have problems with erections, poor libido, and not sleeping well. And that's not good if you're having testosterone therapy and you're feeling that way. Besides that, you need to be aware that when you start testosterone therapy, you're supposed to have your other hormonal systems checked, and be sure your adrenal glands, your thyroid hormones, your insulin levels, and your metabolic panel has been checked, and if there are any disturbances on those, they need to be fixed, because if they are present, the effect of the testosterone maybe not be optimal. The next key element about optimization of testosterone therapy is the administration of the testosterone. You know, there are different types of testosterone available. The most common is the testosterone gel or topical, the testosterone injection or depot testosterone, and the testosterone pellets. If you have a lot of fatty tissue, if you have more than 20% of fat in your body, the administration of the testosterone can be a little bit challenging because you need to have the injection done intramuscular. And for that reason, you need to be sure that you have a long enough needle to reach the muscle to get the medication in the right place. Because if you use a small needle and you do a subcutaneous injection, it may stay in the fat tissue, that when you have more aromatase activity, and maybe that could be a predisposition to turn some of that testosterone into much estrogen. It's better to do it intramuscular, and if you have a lot of fat in your body, you may need to use a needle that is 1.5 inches or more than the usual 1-inch needle that generally we use. Besides that, the presentation of the testosterone can be another factor that influences the effectiveness. because if you use a testosterone gel, that is very convenient because it's less invasive, it could be a little bit unpredictable, the absorption of that gel. And if all these previous factors I mentioned, they have been checked, and you're still doing the testosterone gel for 6 weeks and there's not enough effect, maybe you need to consider another kind of presentation like a testosterone injection or pellets that they are more effective and better absorbed. Now that we mentioned all these important elements, we need to be aware about the possible side effects of the testosterone. Testosterone has a very wide range of effects, but you need to be sure that you keep an eye on your level of blood because you don't want your blood to get too thick and have any clotting events. For that reason, it's good to go and donate blood while you are on testosterone therapy and keep an eye on your hemoglobin. And the prostate is another factor that you need to watch. Some males, they can have a transitory inflammation of the prostate when they start the treatment that usually goes away after some short treatment of antibiotics. And of course, you need to keep an eye on the prostate levels because you don't want it to go any higher. Generally, if you have an underlying process in the prostate that you may not know it, with testosterone, it can arise. And if that's the case, you need to consult with an urologist. Well, and last but not least important, you need to be sure that you work on your lifestyle and try to exercise, big muscle mass because that boosts your testosterone production. Work on your diet, stay away from dairy products, soy products, and processed food. Get healthy fats, eat organic meats and veggies, add a lot of fiber into your diet, and work on your stress level. Try to get a good night's sleep because that's going to help you overall. Well, I hope this has been helpful for you. If you have any questions, please write it for me and I'll be pleased to answer them for you. And hopefully we can see each other again in another video. Bye and blessings to your health.